Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. You know, heart disease is the number one cause of death here in the United States, killing 1 in 4 Americans every year. The American Heart Association reports that more than 6 million Americans are living with heart failure, and 900,000 new cases are diagnosed every year. Our guest today is cardiologist Dr. Daniel Bensimhon, here with his patient, Mr. Chris Rice. And they're going to talk to us about heart failure. And Chris is going to give us a little bit of information about his journey to a new heart and how treatment with a new heart pump saved his life. Welcome to the program, both of you.
Thank you.
Thanks for having us, Neil.
Right. Well, doctor, explain to our listeners what heart failure is and a few of the symptoms.
Yeah, heart failure is a fairly complex condition, but just to boil it down, it's where the heart just doesn't pump enough blood to the body to meet the demands of the body. Mm-hmm. So people get short of breath with their activities, they get fatigued. And then they can also start noticing some swelling. They get swelling in their legs, they get fluid in their lungs, they lie back and try to go to sleep, and they find themselves coughing and can't breathe.
Chris, did you experience some of those symptoms or all of them?
Absolutely, almost all of them, yes.
And were you sure that you were in trouble at first, or is this something that progressed and finally culminated into some big event?
That's exactly what happened, yes. It was, it progressed over and over, kind of reoccurring, mimicking bronchitis and colds and such as that, and the shortness of breath to set in, and once that set in, then I kind of was worried about it. Then that's when I sought medical attention.
Now, is Chris a typical candidate, doctor, for heart failure?
You know, Chris wasn't a typical candidate. You know, Chris was diagnosed at age 36. Mm-hmm. And, you know, a lot of causes of heart failure are due to things we expect, right? High blood pressure, heart attacks, all these things that weaken the heart over time. But there are a bunch of conditions, almost in 50% of the cases, where you get something you don't expect. You get a virus, you get something wrong, a thyroid problem or some other problem which attacks your heart, and you get these symptoms that, as Chris said, were like bronchitis or other symptoms, and you really don't think, wow, this is my heart. So we really encourage people when they have these symptoms, particularly if they persist despite a course of antibiotics or some other treatment, is ask your doctor, could this be heart failure? Could there be something else going on?
Were you diagnosed accurately at the outset, Chris, or did it take a couple of times for you to finally understand and your doctors to understand what was going on with you?
Initially, it took several trips to realize that something else was going on.
So, doctor, what are some of the treatment options out there for folks that are at risk or who are already suffering?
Yeah, you made a good point earlier. This is a big problem, right? There are 5 or 6 million people in the United States who have heart failure. Fortunately, the majority of them, 90% of plus people, we have great medicines now. You get on good medicines. Many people get full recovery and return back to the daily activities. Unfortunately, for about 5 to 10% of this population, they don't get that recovery. And like Chris, they continue to get worse. And Chris actually had a protracted course. He went 16 years, which is quite unusual, before his symptoms really progressed. But once the symptoms start to progress, then we start talking about things, heart transplant, heart pumps. And we're fortunate now to have quite a few options in that category.
As far as heart pumps go, I understand that Abbott's got a HeartMate heart pump. How does that work, and who's a good candidate for that type of treatment?
Yeah, Abbott's really been a leader in the field. It started with Thoratec, and now Thoratec is part of Abbott, and they've really been leaders in the field. They recently released the newest pump, the HeartMate 3 pump, which we've been using extensively and have had great outcomes with that pump. There are really 3 classes of people who get heart pumps: people who are waiting for a transplant but just can't wait long. They can't, like ex-Vice President Dick Cheney was waiting for a transplant but got too sick. So we use it as a bridge to transplant. Then there are a group of people who are going to recover. So they get a pump and then their heart recovers and we can take the pump out. And finally, there are a group of people who are really sick, need support, don't qualify for a transplant, but end up qualifying for a pump and can get several years of really high quality life from the pump support.
Chris, what went through your mind when you were told that you needed a pump and that you were eligible to receive such treatment?
Well, initially, I didn't really know what a pump was, and I believe they nearly lost me a few times before I could actually get the pump put in. But once they explained to me what a pump was, and then I actually was able to speak with another gentleman who'd already had the pump, it gave me quite a bit of comfort, then I was comfortable at that point with getting it.
So you were initially kind of apprehensive about having the pump. Was it the invasiveness? Was it the maintenance? What was your, I guess, your main concern?
Just it being a device itself was a concern. Where I was at that point in time, it was the pump or die, and so the pump was put in and I was back to normal, gave me such a quality of life.
Doctor, talking about the maintenance of the pump, what should patients expect once the pump is implemented, and what should they expect in their life afterwards as far as the pump is concerned?
Yeah, it's a great question. As Chris kind of pointed out, is the first couple of months are tough, right? You're recovering from a major chest surgery. You're getting comfortable knowing about your batteries and all the other things about the pump. So people often struggle through that first couple of months. But once they hit 3 to 6 months, they really, really get back into their normal activities. And by 6 months, they're doing everything and more that they were doing before they got sick. So I think there's a lot of apprehension initially. I'm living on batteries. I got this pump. I got a power cable. And then as they see, wow, I can do all these different things, then they really realize what it's like to be back to a normal life. And some of those other daily concerns fade to the back.
As a recipient, Chris, what would you say to some other folks who are considering getting Abbott's HeartMate Pump implemented, or who are maybe as apprehensive as you were?
I would say to those people that everybody's situation is unique and different. But if they are facing that particular situation, then I would suggest them to seek advice from their medical profession, their doctor, and it would be a great thing for them to have, if they make that decision. For me, it worked out great, but like I said, everybody's situation is unique and different. But I would at least inquire about it.
Now, Doctor, where can our listeners go and learn more?
Yeah, so there are a lot of resources, right? There's about 200 centers across the country that do advanced heart failure work. And so, talk to your primary care doctor, talk to a cardiologist, and now there are even heart failure specialists. So there are a lot of resources. If you want to go online, you got to be a little bit careful. You want to get reputable information. We tell people, if you're interested, if you have advanced heart failure, interested in more heart failure information, you can start at HeartMate.com. It's a great place. You can see more about heart failure in general, about the pumps, and there's a great video about Chris on there as well, so you can learn a little bit more about Chris too.
Well, I thank you both, Dr. Bensimhon and Chris, for coming in and speaking with us today. It's been a pleasure. Thank you both.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of the program are available at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.